gives me great privilege to welcome one of our friends and city's greatest to us, John Ashton. Thank you.
Thank you very much, Robert. Thank you, Chairman. I think what's going on in Wavertree now is really exciting, because some of you will be familiar with something I wrote a while ago about a vision for Liverpool, which enhanced all its villages and really was a strategy for the city based on building it round the urban villages of the city, which I think is what's going to happen eventually, perhaps particularly after the COVID. So Mike Chitty said, can you talk a bit about some of the epidemics in Liverpool as well? And it's prompted me to do a bit of rooting around before I get into the COVID, because some of you will be aware that there was a Liverpool influenza pandemic in 1950. That's something which I hadn't really been aware of, but I've been digging out. There's a paper in the Lancet by Andrew Semple, who was the last medical officer of health for the city, with his colleague Meredith Davies, who was a medical officer of health on the Wirral, and he was deputy for Liverpool, and then he was medical officer of health on the Wirral, I think. But it's interesting how he described and compared an outbreak of influenza in Liverpool in 1957 with the one in 1950, in which more people died than were killed in the Blitz. He makes this point about the death toll of the epidemic that actually began in the northeast, but really reached its height on Merseyside in the early months of 1951. A couple of pointers from that, and this is something I'll get back to in a minute with some of the historical stuff about pandemics. But when the children went back to school at the beginning of January 1951, there was a peak in school absences then. The peak in workforce absences in the city was 2 weeks later than that. And it's interesting now, I'm just hearing that there's been a bit of an increase in children getting COVID in school at the moment, 2 weeks after the Easter holidays. And maybe that will also manifest itself in a uptick, as we use this horrible language, in the adult cases in the next few weeks, because we still haven't vaccinated all those young adults who are out and about, and particularly the ones who are public facing, who are on the supermarket checkout and in the bars and on the buses, bus drivers and taxi drivers and all of that. Because I'm arguing at the moment, and perhaps come back at the end, that now that we've vaccinated pretty well everybody who's in high risk groups, and that the deaths are right down to single figures, we should be using the vaccine to stop the virus spreading. And we should be vaccinating all the people who are out and about every day and in facial contact with other people, and not vaccinating able-bodied people in their 40s and down into their 30s who aren't actually very socially active. So watch that space, and we'll see if the government does a U-turn on that one just now. But let me turn to the COVID, and let me structure this around the pandemic. This is the book that I published in August, Blinded by Corona, how the pandemic ruined Britain's health and wealth. And what I did in this was to capture, on the basis of a daily log I was keeping as the thing unfolded, all the errors of commission and omission by the government from the word go. The chapter headings will give you the sense of what this book is all about and how I've tried to chronicle this. And what I've tried to do is actually capture this story so that it can be used in evidence when the inquiry inevitably happens. I think probably the people who are listening in on this will agree that things were happening so thick and fast that when you look back now, it's quite difficult to remember the chronology of it and what happened when. Well, I've put it all in here. It's all in here, and it's an account. And if you read this book, which is £9 on Amazon, probably a couple of quid more if you go to a legit bookseller, then you'll see it'll remind you of what we lived through from last February. So I'll just tell you the chapter headings just so that we can structure my talk around it to an extent. There's a chapter on plagues in history. There's a chapter called Straws in the Wind, which really rehearses some of the recent experience of new viruses and how we should have known that this might turn up. You know, we had the avian flu, we had HIV, we had Ebola, we had swine flu, we had other viruses that turned up, and we thought that they might turn out to be the big one, as is often referred to the pandemic of 1918-19, which is erroneously referred to as the Spanish flu. I'll come back to that in a minute. So there's a chapter on straws in the wind. There's a chapter called A Disaster Waiting to Happen, which really talks about how we've allowed public health in England to be run down in recent years, how our infatuation with hospital medicine and pharmaceuticals has meant we've neglected the basics of public health, which served us so well before we had any of those things, before we had treatments that work, before we had penicillin and other antibiotics and so on, but which we still need when something like this happens. And we've heard a lot about that over the last year, about the neglect of local public health and what I call shoe leather epidemiology, which is identifying where the cases are, the households, the neighborhoods, and actually through that local knowledge of our communities, which the local director of public health should have with colleagues in the council, with the faith communities, with the business communities and so on, you can really target your interventions. Instead, what we've seen over the last 12 months is an attempt to run this pandemic from London, not just from London, but from a narrow group of predominantly male academics from a handful of academic institutions within the M25, with no local knowledge or lived experience. And we'll come on to that when we talk about how they allowed the Cheltenham Festival to go ahead and how they allowed the game to take place at Anfield with no real insight into what a big game means in a city, which is not just 90 minutes in a stadium, but is a 24-hour social event. There's a chapter on the rising tide in Wuhan and how that was dealt with and how it came here, and a chapter on the virus arriving in the UK and how that was met by the neglect of an absent Prime Minister. And I'll come back to that again in a minute. The chapter about Bahrain rehearses my own personal experience of being asked to go and advise the Crown Prince's task force, which he'd set up as early as the 4th of February last year with a war room in place. Remember what was happening in here on the 4th of February last year? Basically nothing. You know, the frustration that I felt in being in Bahrain, seeing them doing what needed to happen and coming back and seeing the complacency here. And that was the week which I describe as a week in which, you know, was a kind of tipping point. The week beginning the 11th of March, which we'll all remember because it included the Cheltenham Festival, the Atletico Madrid game, the farce about herd immunity, and ultimately the recognition that the thing was out of control because of the failure to get a grip on it in February. The chapter called A Wasted Month, which talks about that stuff in February. The Floating Petri Dish is a chapter about the cruise ship, which you remember was docked in in Japan, and which gave us real insight into what was likely to happen in closed communities. Although not that many people died on the cruise ship, it was a good model for what was going to happen in the care homes when you've got a virus in a closed community and it takes off and infects a large proportion of the people living in that closed environment. I talk about SAGE and the failures of SAGE, how it was too narrowly drawn. I have a chapter on Left to Die, the herd immunity scandal, chickens coming home to roost, about all the failures from the past which had played into it. Remember how we were lied to by Jenny Harris, who said that they discontinued testing and tracing because it wasn't relevant in England, in the United Kingdom, because in developed countries are different from other countries. And then later on, she admitted that the reason they dropped the test and trace was because we just didn't have the capacity to do it because of what had happened to public health over the years. The PPE scandal, the oxygen scandal. A colleague of mine who's in sports medicine told me that the oxygen cylinders from sports ground around the country were commandeered for hospitals because they were worried that they weren't able to find enough oxygen. The piped oxygen in hospitals, which is at the bedside, was insufficient for all the patients. They were having to use oxygen cylinders from wherever they could get them, from the community, from people who have oxygen cylinders at home for COPD and stuff like that. They got away with that one. The public never knew what was happening about oxygen. We're seeing now that situation in India at the moment where they've run out of oxygen. Politically led science and the numbers game, how we were lied to about the numbers, how for 2 months we were led to believe that the numbers that were given to us each night in those staged press conferences was the total, but actually it was only half the total because they were only reporting on hospital deaths. They weren't reporting on care home deaths. And of course, we had the parallel epidemic that took off in the care homes because they discharged patients from hospital to free up beds in the hospital. 30% of the beds in hospital were freed up so that they wouldn't have the political crisis of the hospitals falling over, but the untoward consequence of doing that and discharging infected people from hospitals into care homes was to cause the second epidemic in the care homes. And there were other epidemics as well, not least the one in the prisons, which they've still kept under wraps. You know, we have about 90,000 prisoners. We have about 30,000 prison officers, and there have been significant numbers of deaths among both groups. Until very recently, and I think it may still be the case in many of our prisons, and about 100 out of the 115 prisons in England and Wales have had outbreaks of COVID. But until very recently, they adopted an approach which said they would only vaccinate the prisoners who fall into the priority groups for vaccination, rather than vaccinating everybody in prison and the prison officers, because it's such a high-risk environment. And this is, you know, because of playing to the gallery, worried about how it would run politically if they were vaccinating prisoners who were not in the priority groups before they vaccinated members of the general public who were not in the priority groups, even though the result of that is attrition and death among prisoners and prison officers. The lockdown and the farce over the lockdown, there's a chapter on that. There's a chapter on the forgotten, which includes prisoners and prison officers. There's about the only group that actually did reasonably well in that category were the homeless, because of the initiative to get people off the streets and into hotels. But that was probably motivated by the desire to keep the great unwashed away from everybody else and not to spread the infection, rather than for any benefit to the homeless themselves. Dying Matters, chapter on all of those issues to do with death and dying. Some people may or may not be aware that when the numbers got very high back in the spring, there was a index called the Frailty Index, Rockford Frailty Index, which began to be used to decide who to send to hospital and who to leave at home. And this is a scale of 9 points in the Rockford scale. And anybody who scored more than 6, the clinical decision was that they should stay at home. This was done and implemented without any discussion with family or relatives or anything else. And guidance came out from the National Institute for Care Excellence, so-called, at the beginning of a week, which included people with learning difficulties and Down syndrome and autism as groups that wouldn't benefit from hospital treatment for COVID. That guidance lasted 4 days and was withdrawn at the end of the week because of the ethical scandal that it represented. The independent sage turned up, and we have benefited enormously from that, because whereas the government constantly told us that they were following the science, basically they were cherry picking the science to suit their political motives. Cummingsgate and after, became a cause célèbre, but part of the importance of the Cummings episode relates to the breakdown of trust which has occurred between government and governed as a result of high-profile figures behaving in a fashion that's best described as do as I say, not as I do. And we had a whole litany of those, from the government advisor who had his mistress over for the night to Neil Kinnock, who went and visited Stephen Kinnock, who visited his father for his birthday. We had footballers having orgies with sex workers in hotels. We had the royal family. One component of the royal family refused to self-isolate after they came back from skiing. And many of these kind of examples of the elite who thought that things were didn't apply for them that applied to other people. It's interesting, just in the last few days, that I've had reports that wealthy Indians are flying in private aeroplanes from India to get out of the country. And it's something, the VIP component of this is something which you can trace back to the plague years of Daniel Defoe, when in the middle of the plague in London, the wealthy left their houses and went off to their country houses and took the plague with them and started outbreaks of the plague in the places where they went to. And we saw that with the skiing classes in February half term last year, when all those tens of thousands of skiing families came back from Austria and Italy and returned to their homes in different parts of the country, but predominantly in the home counties, and took the virus with them and seeded it. We had one doctor in Liverpool who came back from skiing, went to a meeting, worked for a week, during which he saw dozens of patients and then became ill. There are many such examples. So that's the structure of my book. Now, let me go back to the beginning and talk about plagues in history. Because, Liverpool has such an important position in the history of public health, starting with the cholera years of the 1840s. And, as the primary port of the British Empire that it became, with the enormous growth of the city and the city's slums. Florence and I were just talking about how Duke's Terrace was saved in the 80s, and as the last example of back-to-back housing. But we had tens of thousands of those houses, and they were built in the merchants' in the backyards of the merchants' houses as the merchants fled from the masses down by the river and the docks, because they built them, stayed there only 10 or 20 years, and then moved further up the hill to get away from them all. And those cellar dwellings, you know, were described so well by William Henry Duncan in his evidence to Edwin Chadwick for the Chadwick Report of 1842 about the squalor, and about how he found as many as 16 people in a room in those back-to-back tenements. I'm talking about the overcrowding when the Irish turned up, and about the fact that this then was just a perfect soil, if you will, for when the cholera arrived in 1848. And first case towards the end of 1848 in back Portland Place. It was a child, it was a girl, and then during the first half of 1849, there were about 5,400 people died from cholera in Liverpool. Now, if you can imagine, the Ebola in Sierra Leone in 2014, the death toll in Sierra Leone was 4,300 or something like that. So more people died in the cholera in Liverpool in 1849 than died in Sierra Leone from Ebola in 2014. So you can get a sense of the enormity of it. Now, I haven't got time to give a lecture on Duncan tonight, but Duncan and Newlands, the engineer, and Thomas Fresh, the sanitary inspector, between them got on top of this by identifying where the cases were, quarantining people, setting up temporary hospitals. They deployed volunteers to work with them. And this was the sort of approach that characterized public health interventions, not just in Liverpool, not just across the country, as public health became established during the Victorian age, but throughout the Commonwealth. And the vestiges of that public health structure are still to be found in Commonwealth countries today, where many of them still have a medical officer of health, but we got rid of ours in 1974 and have only recently returned public health to local governments in a diminished form, where the director of public health in a city like Liverpool is line managed by the director of adult social care, whereas in Duncan's day, and certainly in Andrew Semple's day until 1974, they were a power in the land and they were influential across the entire committee structure of the council. You'll form your own judgment about how the current Director of Public Health is doing in Liverpool, but I think he's doing quite a good job. So we've been here before many times, but the one that really people refer back to when they are talking about COVID is the 1918-19 pandemic of influenza, which is erroneously described as Spanish flu. In fact, it began in Texas at the end of 1917 in a very poverty-stricken county called Haskell. I haven't been there yet, but I intend to get there at some point to see whether they've put appropriate plaques up. But there's a GP there who was out in the boonies, in the sticks, who had several patients who came to him with an atypical form of pneumonia and influenza. And he tried to get the public health service in America interested, but they took no notice of him and nothing happened. And a short time later, there was a significant outbreak in an army camp nearby. Now, at the time, what was going on was that Woodrow Wilson, whose mother hailed from Carlisle, and Woodrow Wilson visited the Lake District a lot. He used to cycle around the Lake District. He's renowned for a number of things. One of them was that he was very backward on racial integration. But the other one was that he became very gung-ho on getting stuck into the First World War. I mean, the Americans, as Churchill always said, the Americans always do the right thing after they've tried everything else first. Well, he was very gung-ho when it came to about 1916 on the Americans joining in, and they mobilized about 3 million young men in America in military camps across the eastern seaboard to come to join in the First World War. Well, the influenza pandemic went through those camps like a dose of salts. And it was a very cold winter in 1917. And these guys were in overcrowded, these squaddies were in overcrowded camps, huddled round stoves in the middle and infecting each other with aerosols. The troop ships were moving up and down the eastern seaboard, moving folk between the camps, getting them ready to come. And then they all came across and there was a large number of deaths on the Allies side, but there were more deaths on the German side when it crossed the trenches. And it's been proposed that actually one of the reasons why the German last push on the Somme failed was because of the pandemic. Interestingly as well, though, when it comes to lessons not learnt by our government this time, not learning about the crowd nature of this disease, not learning about how it could be spread on board ships, but also there was a bond raising, selling bonds for the war effort in Minnesota, and it was very controversial. This was in the September of 1918 when the second wave was beginning to take off, which eventually led to the deaths of between 50 and 100 million people globally. And it was at that point that it became known as the Spanish flu, because the press censorship during the First World War meant that none of this was reported in the press. And it was only in the press when the second wave happened, which happened very disproportionately in Spain, among other places. Now, the rally and sale of bonds for the war in Minnesota took place over 2 days in, I think, September of 1918. Over 100,000 people were on the street, and the influenza was already circulating in the city. And within days, hundreds and then thousands of people were dying from influenza in Minnesota. So, you know, when we come to the COVID and we say, why weren't lessons learned? Why, when you've got an aerosol-borne disease, forget the difference for the moment between influenza and COVID. It looks as though both of these were aerosols spread. Then having people congregate in crowds is a really daft idea. To my knowledge, there's been no historian on SAGE. To my knowledge, there's been no anthropologist on SAGE. Anthropology in pandemics is very important. One of the things that came out after the Ebola in Sierra Leone was that at first it started or became aware to public in the West at Easter in 2014. And the virologists and all the clinical scientists all turned up and identified the virus quite quickly. And then they also identified quite quickly that the people most at risk were the doctors and nurses and health workers who were in intimate contact with the patients with Ebola, but also the family members who were involved in the intimate body washing rituals of the dead. And they concluded this sort of very biomedical perspective, lacking a sociological perspective or anthropological perspective. They concluded that they needed to go and talk to the village chiefs about the burial practices. They lost 3 or 4 months. It was only when anthropologists became involved in June and July of 2014 that they realized that the village chiefs had no authority over traditional burial practices. It was the village women's committees that really they needed to be talking to. And it was only when they started talking to the village women's committees, they were able to change the way the bodies were washed and handled and so on. I think these lessons from history and from other things, you know, are hard learned. So I would draw your attention to the historical couple of chapters in my book if you want to know more about that. Of course, when those first two cases turned up in York at the end of January last year, and when the first flight came from Wuhan, we had more, creative nonsense by the Eton-educated elite of this country, who assumed that the only way people would travel from China to England would be on a direct flight from Beijing to Heathrow, and didn't bother about any other routes of entry. That turned out to be quite grossly flawed. I think we may be seeing a rerun of that at the moment as people come out of India and find ways to get particularly to the UK, which don't involve direct flights from the main Indian cities to Heathrow. I was, this next bit of this, that's, there's so much to talk about. I haven't got time really, but, right at the very beginning of this, Public Health England, which represented this gross over-centralisation of public health, they'd asset stripped the regional and local level. I mean, the regions don't exist as they existed when I was Regional Director of Public Health from 92 to 2006. They don't exist like that anymore. They're civil servants and there are only a handful of them, and they're not accountable to their local populations. But the message went out from Public Health England to the local public health directors, of whom there are about 130 around the country, that they were not to talk to the press or the media. So that's what happened at the end of January and the beginning of February. So I found myself in great demand because I wasn't working for anybody and I'd not taken any king's shilling at that point. And I could speak my mind about this. And I did an interview with Sky Television outside Arrow Park on the 1st of February last year when the Wuhan evacuees had just arrived. And I said, this was like the Millennium Bug. If you remember the Millennium Bug, when we put a lot of resource into the concern that come midnight 1999-2000, the world's computer systems might all crash. So there's a lot of investment put into that not happening. It didn't happen. And then all the tabloids said, what a waste of money. So I drew the comparison with that. And I said, look, it's like that. Sooner or later, we know that we're going to have a pandemic like 1918-19. We don't know when it's going to be, but we have to take it seriously. And we'll be damned if we do, and we'll be damned if we don't, but we've got to take it seriously. That was when the Crown Prince of Bahrain saw me on Sky TV and asked his people to get me to go out and to criticize what they were planning to do. And that's what I did on 2 occasions in February and March. And it was quite a refreshing and remarkable experience to be invited to go and forensically examine what they were proposing to do. And I walked the airport, the seaport, the causeway to Saudi, the prison, the housing estates for the migrant workers, the hospitals, the clinics, everything. Walked it and found the weak spots, made representations to people. They agreed immediately to release 1,000 prisoners to reduce overcrowding in the prison. They suspended the Formula One racing. They ordered a lot more testing equipment. And if you look at if you Google it online, you'll find that they are in the top half dozen countries in terms of the coverage with testing. I mean, we're up there now, but very late in the day. And their death rate has been proportionately very low. I'll come back to that. Anyway, so while Boris Johnson was preoccupied with his mistresses and his Brexit success, he took 14 days holiday last February at Chequers, and he was getting his divorce sorted out. He missed 5 meetings of Cobra. This was all time that was wasted and lost when the weaknesses that had been identified in the exercise Sigma that had been taken place in 2016 and which rehearsed a pandemic of influenza, and which identified the lack of testing capacity, lack of PPE, lack of oxygen, lack of burial facilities, all these things. Report never published, never acted on. But in February, they might have been able to do something to start catching up on all this deficit that we'd had over the past 10 years. But of course, none of that happened, which meant that we got to that point by mid-March where we were a month behind other countries. We'd vested too much belief in what Frank Dobson used to call pointy-headed academics who'd never got their hands dirty, and whose numbers that they were putting into their models were very poor because they weren't testing enough people to have reliable data to go into the computer. And the Americans, in the early days of computers, they had an expression called GIGO, which meant garbage in, garbage out. And the garbage in, garbage out was the models that they were generating from Imperial College, University College, Oxford, these places that actually between them get something like 70% of NHS research money, which should be divided much more fairly with the north of England. So that's another political point that I would like to just flag up. You know, where Geoffrey Rose, who was one of my mentors at London, who was a public health epidemiologist, he used to say, in public health, you need to have clean mind and dirty hands. Well, these guys have got big, clean minds and very clean hands, and they had no idea what that they were talking about. And we've heard those debates going on, and we've heard it the way they've tried to undermine the use of lateral flow tests, which I think are not a perfect thing, but a useful tool to have in your tool bag when you're fighting something like this. I think we should be talking about the lateral flow tests as the people's tests, because lateral flow puts the testing into the hands of ordinary citizens. They need to know the limitations, but the other type of test, the PCR, which we've given billions to the private sector, and they've been unable to deliver properly on it, so that the testing results don't come back for several days, by which time people can have infected many more people. You know, the issues are about practicality. I'm drying up, and I think what I might prefer to do, Chairman, now is stop for a minute or two and take some questions and have some water, and then I can expand a bit more on some of the questions when my mouth's not as dry as it is at the moment.
Okay, what I want to do now is thank John for a terrific talk, really interesting, which I thought it would be, and I'm sure everybody looking in appreciates your wealth of knowledge and how you've put that over, and it's certainly given us something to think about. You know, I don't know how we show our appreciation in mute, but I would like everybody to just put their hands together and clap, and you can hear us.
Thank you. Thank you.